so much. Assalamu alaikum, everyone. I hope you can hear me okay. My name is Dr. Nadia Khan, and I am a consultant in palliative care based in the West Midlands. And I've been working with the British Islamic Medical Association to raise awareness of the upcoming legislation around assisted dying or assisted suicide, because it's a really important piece of information and has significant impact for us as medical healthcare professionals, but also the wider community as well. So really pleased to be joined by Pete Donnelly as well, who will be bringing a perspective on the bill. Next slide, please. So Naomi, next slide, if you can move on. Yeah, great, thank you. So I think most of us will probably be familiar now with the bare bones of what the bill is about, but just as a quick summary and recap. So the bill at the moment, which is passing through Parliament, is called the Terminally Ill Adults End of Life Bill, that is essentially looking to make provision for people who are terminally ill and meet certain eligibility criteria to be able to request and then lawfully be provided with assistance to end their own life. So in terms of who is eligible, it's currently standing at adults who are 18 plus who have been diagnosed with a terminal illness and are expected to die within 6 months, and who are, quote unquote, mentally capable of making the decision. The bill is moving through Parliament at the moment, so you will have heard in ebbs and flows about the bill in the media, depending on what stage it's been at and when the MPs are due to debate and discuss it. But the third reading, which is arguably one of the most important parts of the parliamentary bill process, is going to be taking place in the next few weeks in the middle of June, although this could be pushed back depending on what happens within Parliament. The whole point of the bill is to promise choice for the terminally ill, but our concern is that the reality of the situation is much more complex, and that this bill is going to have a significant impact for those people who are marginalised and vulnerable within society. Next slide, please. So when we think about the assisted dying bill and the type of rhetoric and conversation that we've seen around it, what's really interesting is to see kind of how the proponents of the bill, so the people who are looking to get this legislation passed, how they see it and how they're framing it for society. So very much, so I should introduce, the next couple of slides are actually advertisements that were put up to celebrate or at least put forward the bill within Parliament when it went for second reading back in November 2024. And these adverts and billboards were plastered all over Westminster and London in the Underground. And you can get a sense of kind of what the framing is from these adverts themselves and what the key arguments that are being put forward are. So here in this particular picture, you can see this very joyous woman who it seems to be kind of just woken up for breakfast and seems to be full of a sense of freedom and liberty and joy around the dying wish that her family won't see her suffer and that she won't have to. So it's quite interesting, again, in terms of the framing of the visuals of what this is saying to us. Next slide, please. And just click, Naomi, I think, yeah. And then the second billboard shows us a cyclist who is obviously quite young, looks quite fit, active. Cycling is an expensive hobby, so we can assume actually he's got a good socioeconomic background as well. And here the second main argument is being put forward, which is around choice. So proponents of this bill feel that this bill is necessary because it offers choice to people. And again, interestingly, in this billboard, it says, my dad didn't have this choice, and this is a choice that I want to have for myself. So, but I think that's very, very important, because choice and also the experience of dying are two key aspects of some of the arguments, but also some of the realities behind this bill that we need to think about in more detail. Next slide, please. Okay, so question about language. So the bill itself and the proponents of the bill talk about this being around assisted dying. And language here is very important because I would argue, and many people argue more accurately, this is not assisted dying, this is actually assisted suicide. So the bill itself is looking to provide provision that would amend the Suicide Act of 1961 in the UK. And essentially, it's there to provide a legal defence for individuals who assist a death under the new law. So at the moment, as it stands, if you assist someone to commit suicide within the UK, that's a criminal offence. And you would be potentially liable to prosecution. Although in the cases where that's actually ever been the case, where someone has supported someone to commit suicide in the face of terminal illness, very much so, the CPS has not seen that really to be something to chase into prosecution as such, because it's been viewed, the context of that suicide has been kind of taken into account, so to speak. But this is really about changing the way that we approach suicide. And so technically assisted suicide is the right language and the right description for it. But as you can imagine, for some people that is a bit challenging. Next slide, please. So why are we actually talking about this? So particularly from the Muslim perspective, assisted suicide is very much an ethical issue. It's an issue of principle alongside the immense practical issues that need to be considered as well. And we might sort of consider or argue that actually, as Muslims, from our perspective, from the theological perspective, religious perspective, and from the ethical perspective, it's not something that as a grouping, as a community, we would personally undertake or accept, and we wouldn't want to be part of that. So why don't we just avoid it? Why not just let it happen, and that's okay, we just won't take part in it? But actually, I would argue that ethically we also have an issue. We also have a duty to speak out for the public good, and if there's an issue there which is going to cause harm for other members of society alongside us, then that's our imperative, ethically and religiously, to speak out. And there will be consequences for other people, but arguably there will be consequences for all of us, because this bill will impact our fundamental relationship with healthcare. And so the British Islamic Medical Association stands in opposition to assisted suicide being legalised. And it's really important to note that although, yes, we are against this on point of principle, alongside practical issues, which I'll come to in a second, this is in keeping with many of the different groups and cross-sections of society, and there is significant opposition from people of all faiths and no faith as well. So very much the arguments around the practical implications run through the thread of society, and that's really important that we work alongside other communities who are equally concerned. Next slide, please. So what are the key concerns? So there are key specific dangers which can be sort of broken down into sort of three main issues. So the first issue is coercion. So the real concern that there is, that many people hold around the bill being legalised, is that the bill and legalising assisted suicide will create a pressure for people to undergo assisted dying. And this may be vocalized, but there may also be an internal pressure, particularly when people often, when they're vulnerable, when they're unwell, when they have to rely on others, can end up feeling like a burden. And they can worry about causing either financial burden or hardship or time or resource constraints on others, especially their loved ones. So although people may not be told you must undertake assisted dying, but there may be this pressure, actually people would be better off if I wasn't here, and assisted dying provides a framework out within that. Alongside that, there's a real concern that actually, for those people who already have poor experiences of healthcare, and already are quite marginalised, whether that's due to their disability status, or whether that's due to socioeconomic burden, or whether they've had poor experiences due to their systemic racism within healthcare. Already we know that certain people don't get the same experience within the healthcare system, and we're concerned that people will increase in their loss of trust as they doubt the motivations of the doctors and nurses that are looking after them and the system that's there. And this increase in medical mistrust will end up translating into a reluctance to seek care, including end of life and palliative care, which will just inevitably cause a widening of the healthcare inequalities and worsen the healthcare outcomes for people and their families. And as I've already mentioned, certain groups are more vulnerable to coercion, and we've seen this play out in terms of the increase of certain groups within other countries who have legalized assisted suicide or euthanasia, who have higher proportions of taking up that. In addition to this, the lack of investment within palliative care and also services and support for disability groups and people who are living with disability will mean that actually this can potentially end up limiting choices for others if this particular bill and this mindset comes into play and is normalised. Next slide, please. I think alongside this is the broader picture, which is how society sees the life that is valuable, and the death that is valuable as well. And our concern is that once assisted dying becomes normalised as a quick and safe solution, quote unquote, easy solution, this will actually end up reducing down the push to try and find other alternative approaches to mitigate people's suffering within society. And not just this, when we start to devalue some life, we'd then end up reducing down the compassion within society for all life, which may be a struggle. Already we're seeing that within society there can be economic cost associated to life, and this is playing out in terms of the current discussions that are happening around benefits and payments for those who are in need of them for support, and we are starting to kind of weigh up the value of people's lives, really, which is very disconcerting and is going to potentially be worsened by this sort of economic analysis that we're doing of some lives being worth living, but others where actually if they're ended, you will end up doing a cost saving, for example, which is quite a scary thought, really. I think assisted dying will potentially become a self-fulfilling prophecy, as there's less of a social impetus, and healthcare institutions normalise assisted dying as kind of a way out, but maybe a preferred way out. Increasingly, there'll be less push to try and find solutions for suffering, and so then assisted dying becomes the preferred option even more so. And we would argue very much that robust end-of-life care and support are absolutely essential, and this value may shift as assisted dying becomes normalised. Next slide, please. I think this slide speaks to just the changes that we're seeing already. So this is the background and the context, the backdrop that we're seeing to the assisted dying bill, which is that overall in society, we are seeing a shift in the amount of empathy that there is generally for one another. And as financial pressures increase, media plays its part in terms of pitting one group against the other and seeing some lives as being more burdensome for society than others. That is a huge issue. And as I've said already, there are political aspects to this as well when we are trying to figure out the cost of living, and also think about how we support people who have extra needs within society to live well. Next slide, please. So is assisted dying something that's wanted by society? So polling has suggested that, generally speaking, British society for about at least a decade now, polling has suggested that when you ask the British public about assisted dying and whether that's something that should be legalised, depending on the wording of the questions, about 2/3 to 3/4 of the population seem to be in favour in principle, or theoretically about the choice. But interestingly enough, when you actually look at the polls that have asked about safeguards and whether people felt that robust safeguards could be put in place, that really starts to then shift the level of support that we see within the polls. So, for example, Sky News back in December 2024 did a poll, and it said that 62% of the respondents supported the assisted dying bill in principle, but 70% expressed concerns that disabled individuals would be encouraged to seek assisted dying against their will. And there's similar polls as well that were carried out whilst the actual bill was being kind of working through Parliament. So as people start to think about, yes, maybe the principle, but then when the practical element comes into play and people start to think, well, how would this play out in reality? The reservations start to come into effect. And that's what we're seeing with this bill as it's moving through Parliament. Increasingly, people are concerned and worried about what this will practically mean. Next slide, please. So what are the Royal Colleges and what is the medical professional society saying about this? So many of the medical representative societies have moved to a position of being neutral on the issue of assisted dying. So neither for nor against, putting it solely in the domain of society needs to decide upon this. But as time is going on and the bill is being discussed in Parliament and the practicalities of it are being examined, colleges are starting to speak about the concerns that they have. So a case and example is the Royal College of Psychiatrists. So they have come out on the 13th of May, so not too long ago, and they have essentially said that they cannot support the bill in its current form. They have again, many practical concerns. There's a whole raft of concerns over there, which I'll go into in a bit more detail. But essentially, they say that this bill is not safe in the current format that it's in. Next slide, please. The RCGP, which moved to a position of neutrality back in March of this year. Interestingly, BBC News recently did a poll of GPs, and again, as the bill is being discussed and the practical implications are being thought through, it's actually showing that there is a huge split within the GP profession about assisted dying. And in this particular poll that BBC News did, they had 1,000 respondents from GPs, and 500 were opposed to assisted dying being legalised, and 400 were in favour. So that goes to show just how polarising this issue is. And then the Royal College of Physicians has put out a position statement, again, not too long ago, and they are less strongly worded than the Royal College of Psychiatrists, but they've said that there's remaining deficiencies that need to be addressed in order to achieve protection of patients and professionals. So again, really concerning. Next slide, please. Okay, this won't be a surprise to you, so I'll go over this quite quickly, but BIMA carried out a poll of Muslim healthcare professionals last year, and it showed that the vast majority of Muslim healthcare professionals are against assisted dying being legalised. And importantly, over 3/4 said even putting aside their religious views, they were concerned about assisted dying for practical and ethical reasons. And as you can see, there's strong figures that are concerned around the societal consequences for assisted dying in terms of trust of healthcare institutions and the devaluing of certain lives. Next slide, please. More than half of the people who responded felt that introduction of assisted dying would affect their career choice as a doctor, which is really important and has implications for workforce. And only a fifth felt that sufficient safeguards could be built in to avoid coercion, pressure, or other misuse of the assisted dying legislation. Next slide, please. So, as medical professionals, one of the things we need to think about is our relationship, our therapeutic healthcare relationship with patients, which is really the cornerstone of medicine. Medicine is not just a technical skill. Medicine is the art of the healthcare interaction, and that's really, really important. And the ethos of medicine. And shifting that ethos of medicine to include the idea that some lives aren't worth living, so those who have a limited lifespan, has significant implications. There's the risk of, first of all, assuming that some lives actually aren't worth living, and therefore, actually, do we need to push as much for them in order to find those life-saving or life-modifying interventions, for example? So there's a concern that we could end up dehumanizing certain types of lives, and that this means that there will be potential bias opening into both our unconscious and conscious decision-making as healthcare professionals. I've already mentioned that the undermining of patient trust is a huge risk for us, because vulnerable patients may then start to fear substandard care. And already those concerns are there. We saw them within the COVID-19 pandemic and beyond. And then we know that this sort of thinking, when it's been introduced into the medical professional arena, where some lives aren't worth living, that has had significantly negative implications in the past for certain groups of patients. And this particular idea is sort of fundamental to, eugenics that has happened in the past, and also, research that has been carried out unethically on participants. Next slide, please. So this slide demonstrates the assisted dying process. So as you can see, there's a 10-step process within this, and I haven't got time to go into all of it in detail. It is there and it's available for you to refer to, just to understand in more detail. But what I want to kind of draw your attention to is the yellow bit, which is next to the black process. And the yellow column shows all the different problems that haven't been dealt with within the assisted dying bill. And so there's so much there that needs to be sorted out. I wouldn't really know where to start. And this is part of the issue, because this bill has moved so quickly through Parliament. It's gone through a particular parliamentary process, which has meant that there's not been the level of scrutiny and thinking through that's been required for a bill of this complexity and implication and consequence. Next slide, please. But some of the key concerns, if you were to ask me to try and pick out a few, I think my top three would be, one of them is prognosis. So 6-month prognosis, really difficult to actually accurately prognosticate that. It's hard to prognosticate even patients who are very close when they have days left. It can be hard to tell. So 6 months is just unworkable, really. Some of the issues are, where to start? I think thinking about the population that we particularly are from, the communities that we're from, one of the concerns I would have is that patients can't stop doctors from raising assisted dying. So if you were against it, or you didn't want to hear about it, if you were worried about it, a doctor could raise it, whether they realize the significance of it or not for you, and you would be thrown into that conversation. You've got no choice really but to engage with that issue. Vulnerable people, including those with mental health and learning challenges, could qualify for assisted dying. And there is no legal requirement to include or even notify family members within the process, which is a real concern, I think, particularly for those communities where family-based and collective decision-making takes place. Doctors do not need to ask why a patient is asking for assisted dying, which just seems, it just doesn't make sense to me at all. That's not the way that we would kind of carry out any form of assessment of a patient when we're talking about an intervention of any serious magnitude. There's no assessment from a mental health professional required and no psychosocial assessment. So it's just very much focused on mental capacity. Have you got the capacity to make a decision, which we would argue is just not sufficient for what we're trying to do here. And the decisions that are sort of made are being kind of rubber stamped really by a voting panel. There's no real judicial oversight. A legal professional is involved in an MDT type panel to try and sort of say that the process has been followed robustly, but actually they've got no real kind of direct involvement in that assessment process at all. And finally, I would say the lethal drug administration. There are very few rules that govern the administration of these medications. Obviously, they haven't gone through any MHRA process. The whole system itself could be altered by ministers later anyway, because there's so much that's not covered by the bill. And it could become a private for-profit service as well. I mean, I could keep going, but I'll stop there for now. Next slide, please. Conscientious objection, that's going to be important for us, isn't it? So the bill has stipulated with some clause changes that have happened as well recently that no registered medical practitioner or health professional is obliged to participate in assisted dying procedures, and this protection extends to doctors, nurses, pharmacists and pharmacy technicians. However, it's important to note that there's no protection for non-clinical staff within the bill, and there is you still may well be obligated to refer, and there is a rejection of institutional objection. So hospices and care homes cannot opt out of providing assisted dying on their premises. So there's a lot there that's grey still. Next slide, please. And what's happening in other countries? Well, essentially, we're seeing that assisted dying and euthanasia, the scope of it is being expanded. Increasing deaths are happening due to assisted dying and euthanasia. The reasons for having assisted dying are being expanded, and increasingly more concerning stories of coercion are coming out, and some are very distressing to hear, to be quite honest. Next slide, please. Next slide, please. I think I've covered all of this already. So what do we do then? So for me, I would say that one of the main things is we need to think about how we prioritize good care. Fundamentally, 2/3 to 75% of the British society feel that assisted dying in a principle, at least, is something that they would want. And underpinning that is a concern and a fear around pain and suffering at the end of life. And a lot of that is, I would argue, down to the lack of good quality palliative access that is available for everyone. And I think I would argue that if we had that in place, then actually the perceived need for assisted dying would dramatically change. Next slide, please. My final slide I would end on really is that there's a wider challenge for us all when it comes to assisted dying. Again, as I alluded to, there's this desire for assisted dying there in society, and that may be being kind of harnessed by particular areas of and lobby groups that are looking to legalize this particular issue on ideological purposes, but actually how are we as society supporting those people that are vulnerable, those people that are lonely, those people that are isolated and marginalized? We need to really, as I would say, as Muslims, as good human beings, we need to really strive and start to think seriously about how do we support that increase of compassion with society beyond just when it's convenient for us, but also we need to kind of rooted in our own principles, our own ethics, remind society that dignity lies in actually service of others and caring for others when they're vulnerable, not discarding or abandoning them, which is a massive fear for people. And we need to start thinking about how we do this, not just in our day-to-day, but also how do we cultivate this within healthcare better. So there is a challenge there in us, within all of this for us, that we need to start to grapple with. Next slide, please. So what we can do, so I think it's really important to start to raise awareness. I mean, we're not far off the third reading. We've got really 2 weeks or so now just to really start to get the message out there and share this information with families, with massages, with community centres, and start to really try and understand the specifics of the bill. There will be lots of sound bites, lots of rhetoric, lots of framing of the bill as a positive thing, centering on choice and compassion and narrative. But it's really important that we actually see this for what it is. And we really need to contact our MPs. That's one key thing I would say that we need to focus on, so that we can try and demand that we get better care for people and we support people to live, not to just die. Next slide, please. So before I hand over to Pete, what we will do is we will also have this slide at the end of the presentation, but I would really urge you, if you haven't already, to engage with the email campaign that BIMA is running. It's a 1 minute email template that you can complete and send to your MP. You don't have to do anything in terms of any hard work to try and create an email there. It does it all for you. And get that out within community networks so that everyone is lobbying their MP. And we also have a WhatsApp group, broadcast group, where you can stay in touch with information, particularly over the next 3 weeks, where we'll be doing a push, inshallah. And finally, on the BIMA website, we've got a whole section dedicated to assisted dying. So all this information and more is there for you to see. Okay. Jazakallah. Thank you so much. I'll hand over to Pete now to add his valuable perspective to the conversation.
Thank you very much, Nadia, for that. We're really pleased to have Pete Donnelly with us today. He is a committee member of Not Dead Yet, one of the charities you saw in the previous presentation. He is a TEDx speaker, a Churchill Fellow and disabled social innovator from London. He has spent the last decade working in programme management roles across several charities that focus on supporting disabled people. He's also the founder of the Wheelchair Skills College, an inclusion portal which both aims to create social change and also improve the lives of disabled people. And he's been working on the assisted dying bill work with Not Dead Yet, and we're really pleased to have him today. And I'd just like to invite you now to just give us a few words. Tell us about yourself, tell us about Not Dead Yet and the work that you're doing, please. Thank you very much.
Hey, thanks, Naomi, and hello everyone. Assalamu alaikum, and thank you very much for inviting me down to speak tonight. It's a really important issue, and really want to say thank you to Nadia as well for such a kind of insightful presentation that covered a lot of the key elements of this bill. So, just like to start by giving you a bit of information about Not Dead Yet UK, then talking around what disability is and how it's going to affect those people, and then going through what we see as some of the key risks of this bill. So, Not Dead Yet UK is a secular campaigning organisation led by disabled people, and we are a single issue campaign organisation, and we are against assisted suicide and euthanasia. We operate all over the country, got members in different places, but mainly based in London. And we have been established since 2003. In 2003, a group of disabled people came together because at the time, there was no voices from the disabled community being heard on this issue. And we felt it was important to put forward the concerns of disabled people. This, however, isn't a new issue that we are discussing today. Just to give you a bit more background on assisted suicide, it's been the original bill was actually put forward in 1935. So it's been discussed in one form or another for nearly a century. And the person who put this through originally was a doctor who believed in eugenics. So you can see from the very origins of this bill how it's been framed and what it was aimed at doing. Now it's never got this far before, and I'll touch on it a bit later, but it's got further than it has before because it's been put forward as a private member's bill this time. And we also see from the advertisement shared before as well that the proponents of this bill do have a strong media campaign and strong media presence and a narrative that is easily digestible by the public, even though it is really, really inaccurate. It proposes that if you have this option, then everything becomes easier. When that's just such a fallacy. Um, it does not create choice. This bill would create an expectation. There will be people feeling like a burden who feel like this is their only choice. And it is going to affect people disproportionately. I mean, the people that you see in those adverts are people of a certain age. They probably very comfortable in their lives, and they have family surrounding them. They have the option to take that out, to take that route when the pain becomes unbearable to them. But we know that that is not the experience of a lot of people from marginalized communities. And this is why, as a group of disabled people, we felt that we need to make sure that we don't let this get through, because we know that we're going to be one of the groups that is affected more by this. And when I talk about disability, I'm talking about all sorts of impairments. So whether that be physical disability, physical impairment, a cognitive impairment, mental health issues, all of these things could put people in a position where they meet the criteria for assisted suicide. And even as this bill has been put through, we do not have the safeguards in place to protect people. Um, Even conditions like anorexia would fall within under the remit of this bill. So conditions that can be treated would be put in a position where they could get assisted suicide when things got too much for them. And disability crosses over every part of identity, whether it's age, whether it's geographical location, whether it's religion, gender, sexuality, whatever it is, disability cuts across everything. And so we are talking about people from every type of community that will get affected here. So and it's not small numbers either. Some of the latest figures say that 1 in 4 people have an impairment of some type. So that's a huge number. And then you think about the friends and family members as well. You start realizing just how big a population that we're talking about that could get affected by this. So when we're looking at the bill that is being put through now, the terminally ill adults end of life bill, we look at that and we don't see any safeguards that are going to protect people. Um, it's been rushed through, and it's been rushed through without the regular checks and balances that would be usually seen in a piece of legislation that is put through by the government. But because this has been raised as a private member's bill, it's not been scrutinised in the same way. And we do have fundamental concerns about coercion, abuse, and that social devaluation of life. Um, so just thinking to some of the key risks, and Nadia went into a lot of this before as well. There's just such a big crossover in what we're going to be talking about. But coercion is real and it's hard to detect as well. Some of the safeguards in the bill um, kind of talk about coercion being obvious, but it's really not. It can be the most subtle thing. It can be indirect. It can be hidden. It can be internalized as well. So all these things around the coercion elements, they're going to be incredibly difficult to detect. And there's not going to be the investigation that is needed in order to understand if someone is being pressurized to take this option. And the 6 month prognosis, um, two things on this. One, that as has already been mentioned, it's unreliable. There's no way to be sure when someone is going to have a terminal case, and judging when their life will end. We have members who are involved with us who got a terminal prognosis, and thankfully that prognosis was incorrect. And 20 or 30 years later, they're still with us. And at the time, they've said that, they were going through really tough times. They were in a lot of pain, and if the option had been there for them at the time to have the assisted suicide, and they didn't have that support from their friends and family, then they might have taken it and they won't be here today. But because they were offered that support through friends and family and supportive medical professionals, they chose to keep on fighting. And then they're still here because of that. And people feeling like a burden is a reason that we see people choosing assisted suicide in other countries as well. Oregon in the United States is one of the places where assisted suicide is legal. And a poll there showed that 50%, so half of people who take assisted suicide, say it is in at least part because they feel like a burden. Again, it's one of these things, if they were given the support socially, then they may choose that assisted suicide isn't for them. They may choose to keep on fighting. So it becomes not about stopping people from suffering from pain. It's about social issues, and social issues are things that we can fix. We just need to work together as communities to offer support to people, but also to make sure that governments are funding the right places. When people are looking at assisted suicide as well, it assumes that everyone is starting from the same place, but it's not true. When we look at disabled people, and the barriers that they face in everyday life, accessing public services, whether we are looking at social care, housing, assistance to financial support. There are so many systems that are stacked against people, underfunded systems that aren't accessible. And because of this, it means that people are constantly fighting. And if they have an option to take a pill that is an easy way out, then that all of a sudden becomes a very attractive prospect instead of constantly fighting. And it was mentioned before around palliative care and the lack of funding that's being put into that. Um, a survey showed that 90% of people who benefit from palliative care don't get it. So you're looking at people being scared of death and not wanting to go through a painful death, but they're not going to get access to that pain relief that could make their end of life more comfortable. So what we want is to see a better funded palliative care system, because making people comfortable at the end of their life, we we're not we're not wanting to see people in pain. That's not the objective of our campaign. We want to support people as to be as comfortable as possible, and that funding palliative care is one way to make that happen. There are just very negative attitudes towards disability as well. And as I said before, with people constantly facing those battles to access services, there is a negative social perception, there's a stigma attached to disability. And this affects everyone in different ways. whether it's lack of understanding from invisible disabilities, whether it is visible disabilities getting treated in a certain way. So I'm a wheelchair user. So my experience of society is very different from someone with an invisible disability. But we both face barriers in different ways. And again, that starts to shape up your reality. And when you're constantly facing these stigmas, if you're not able to keep your resilience up and you start to believe that as well, then you start to think, well, maybe I shouldn't be here. Um, and it only takes a few things for someone to have, bad days that turns into mental health issues that can be ongoing, and then all of a sudden, these ideas become a lot more attractive when people can't fight on any longer. So we're looking at a bill that says that there are safeguards in place, but when we look abroad at how this has played out in other countries, we know that these aren't effective safeguards, and it's the start of a slippery slope when you start introducing an assisted suicide bill. These bills always expand, and then all you have to do is look at places where it already exists, places like Oregon in the United States, where there have been cases of women with anorexia who've gone through this process, things that can be treated. Um, in Belgium, there's no age limit on the euthanasia program they have there. So as long as the person is deemed competent, then they can go through that process. You look at Canada with the MAID program that they have there that was introduced in 2016. It's now expanded to go beyond just support offering assisted suicide to terminally ill patients, and it actually now covers a lot of social issues. So people are able to access it for a number of reasons, and it now accounts for 4% of their annual deaths. So we are looking at failings of society that lead people to take this. It's not around the picture that is being painted by proponents of this bill and the reason it's being put through for terminally ill people. As mentioned before, the bill has lacked proper scrutiny. This has been put forward through as a private member's bill, as opposed to a piece of legislation that would be put through by the government that would be have a lot more checks and balances. We look at the lack of scrutiny that was done during the committee stage of this. There was a lack of experts that were allowed to speak there. A lot of the people that gave evidence came from positions of being in favor of assisted suicide. So it was a very one-sided discussion a lot of time that was happening. And there was a lack of voices of disabled people in that committee section of this bill as well. Now, I was present last week when the latest report was submitted to the House of Commons for a debate. And when I was watching that debate, I saw a lot of people speak passionately about this. A lot of people talking about stories about their constituents and how their constituents would have been potentially um, kind of fitting in the criteria for this, but they were offered help instead, and because of that, they were able to continue living. When I was watching this as well, in the House of Commons, I watched the time each person speaking, each MP speaking was cut down, Originally, people were supposed to have 15 minutes to speak, and then it was cut to 8 minutes, and then it was cut to 5 minutes. I mean, we are talking about a bill that will end people's lives, and it's not being debated properly. In that section, when the report was discussed last Friday, there were 9 amendments being discussed. Of those 9 amendments, only two of the MPs that put forward amendments were able to speak about the amendment that they were suggesting. That means that 7 of the 9 amendments will be voted on without being discussed in Parliament. Um, Another thing that we can look at whereby this type of thing has happened for is if we go back to something quite recent and the COVID pandemic. Now, disabled people were disproportionately affected through the COVID pandemic as well because of the systemic barriers that exist in healthcare, and they made up 60% of COVID deaths. Um, some people had the orders for do not resuscitate put in place without their knowledge. And unfortunately, these systems exist, and this will be the system that people have to engage with in order to go through the process of assisted suicide. And being part of that process will just build distrust with the medical profession, potentially more than it already is for some disabled people who've had bad experiences before. And this distrust will mean that people potentially choose not to engage with medical facilities because they're scared of what could happen, especially if in a conversation the person they're speaking to could raise the idea of assisted suicide to them. What what our message is though is that we don't want assistants to die, we want assistants to live. We want funding to go into all these areas like social care, like social welfare, like healthcare, to make sure that we have the best possible facilities available to everyone to live the best life they can live as well. We don't want this option to be hanging over people where assisted suicide is there for people when life gets too much because we should be supporting people to live. An analogy I heard the other day was if you're crossing a river and you see someone stood at the side of the bridge ready to jump, I mean, would you push them or would you pull them back in? Um, so our message to MPs is that this bill does not create choice. It creates an expectation. It is an unsafe bill, and scrutiny through the committee stage has only highlighted that there are not adequate safeguards in place. And those safeguards have been removed rather than strengthened as they should have been. The assisted suicide laws always expand. We've seen this in other countries, and we know that this would happen here as well. So we're asking MPs to remember that their vote is going to shape the future. So we're asking them to turn up, vote, and reject the bill. So thanks for listening, everyone, and happy to take any questions.
Thank you so much, Pete. That was really powerful. Would you just very quickly maybe summarize what there's some questions in the chat as well about support that might be available for those who may be in the Muslim community who need support. Is there signposting not dead yet do? A lot of people are very worried and anxious. Could you maybe tell us what Not Dead Yet are doing and how we can support you and get involved as well?
Absolutely. Well, I will drop a link in the chat later and we can circulate that as well. But we are asking people to do 5 things. So we're asking people to write to their MP. So I'm really pleased that's already been mentioned today because that is a really important thing that you can do. We really need MPs to hear the constituents do not want this bill to go through. The second thing is that we do have, as well as writing to your MP, we have some postcards that you can order on our website. So if you are part of a community centre, a mosque, you can order a pack of postcards. You can give them out to your friends and family members, and that's got a message around the risks of assisted suicide already printed on it. You can write in the name of your MP, put a stamp on it, and then send it off to them in Parliament, and then they will get the message about the risks of assisted suicide. Um, for those people who are disabled or maybe have a disabled family member, we're asking people to record videos as well. So just short videos, maybe a minute long, just to talk about the concerns around the bill. Um, it's going to affect people in different ways, and it's really important to share your thoughts on how it's going to affect you. So we've got a couple of questions on our website as well, and a bit of guidance around recording yourself on your phone as well. So please do check that out if you'd like to make a video to share on social media. We do have a number of social media channels as well. So you can get to those through our website and kind of keep up to date with what we're doing. You can see all the videos that have been recorded so far as well. And if you can kind of follow those channels, it just gets us out there a bit more and we're able to share our message a bit more as well. And the last thing is that we are going to be holding a number of events throughout June. The next discussion debate at the House of Commons will be on the 13th of June, and we will have a presence outside there. If you are London based or if you're happy to travel for the day, it would be amazing to have you join us outside Parliament on that day when we can come together and we can let MPs know that we don't want this to go through.
Thank you very much. I'm just going to bring Nadia in as well because we've got a couple of
Right, thank
questions.
you.
I know we said to half past, but if anyone wants to go, this is recorded, but we'd also just like to just answer some of the questions that are here. Maybe you could probably both speak to this one. Do you think there's a concern for people with mental health issues who may choose assisted dying when they're going through a depressive episode, when they're not feeling well, for example, and still then display capacity to consent? I think perhaps if we go to you, Nadia, first, and then Pete, if you have anything to add, we'll give you a bit of a break because you've been talking, and come back to you.
Yeah. So with the bill stipulates that there needs to be a terminal illness present in order to qualify for the assisted dying bill. But as psychiatrists have already raised, actually having a terminal illness is a risk factor for depression in and of itself. So we know that the main time that a person will experience profound depression with a life-limiting illness is actually straight after diagnosis. And then that mental health status improves sort of around 3 to 6 month mark. But that is a risk factor. And as Pete's already mentioned, there are mental illnesses which have a physical manifestation, which would then end up qualifying you for assisted dying. For example, anorexia, where the physical impact of the actual mental condition itself then means that actually prognosis is limited. So this is a huge issue, and the Royal College of Psychiatrists have brought this up as one of the safety issues with the bill itself. So absolutely, this is a real concern, and the bill completely lacks any sort of psychosocial assessment. It's literally just about, have you got the capacity to make a decision? There's no wider holistic exploration as to, well, why is this person asking for assisted dying? What could be contributing factors, etc. So it's completely not the way that we would practice medicine in the first place, in a holistic discipline. So yes, it's a real concern.
there anything you'd like to add there?
I think also just to go back to the fact that we've seen these laws expand in other countries, and when they do reflect on the social issues that are happening, people going through tough times, and then choosing assisted suicide as a solution to that, rather than something as simple as housing being provided. And as we know, kind of we can go through tough times and we can come out the other side as well. So we need to be focused on the support to be given while people are still alive rather than offering them this way out. And I think that's the real risk with this is that
Mm.
slippery slope and the expansion of these laws that I do believe that it would, yeah, disproportionately affect people with different conditions, mental health issues certainly being one of them.
Yeah, and another, thank you for those. Another one, it was kind of two. One has asked what to do if your MP is supporting this bill instead of voting against, what can we do? And the second one is if my MP has already voted against this bill, so the opposite situation, is it still worth writing to them? And if not, what more can we do? So, Nadia and then Pete, please.
So if your MP is supporting this bill, I think what's important to remember is that number one, many MPs still don't understand the details and the nuances of this bill, is one thing. And number two, many MPs, although they might be in favour in principle because of the idea of having choice, actually many MPs are also wavering because they are starting to see the issues with this bill. So I would say, look, we need to try our best. We can only do our best, and then beyond that, it will be what it will be. But if actually your MP is supporting this bill, particularly as a healthcare professional, if you're a healthcare professional, you have a powerful voice, and MPs are willing to listen to that. So if you can visit your MP, particularly if you're a healthcare professional, that's really important. So I would very much advocate that, and we have got support in terms of material and information and notes in which you can explain what the issues are, so you don't have to do all that homework. It's been done for you. And in terms of if your MP has already voted against this bill, just thank them for that, because actually they need to have that reinforcement to know that their constituency is behind them.
I think that for the MPs that are pro this, we know that some people aren't going to be able to be shifted on this, but we know that there are about 80 MPs that voted yes in the second reading, but it was a yes with reservations. So we've got a long list of MPs that potentially will change their vote. Um, we the vote last time was won by I think 55. So there's a lot of potential to change enough MPs' votes to stop this bill going through. Um, what is difficult is that some people are for this in principle and don't understand the barriers for disabled people that I spoke about before. But listening to the debates going on in the House of Commons last week, it became apparent that it's going to be much easier to shut this down if we look at the problems with this bill rather than the problems with the idea of it, because these things are very apparent. So everything we touched on before, kind of the lack of safeguards, the fact it's been rushed through, the fact it's not been scrutinized properly, the fact we've not had experts come in to speak about this. So I would suggest that when you are speaking or writing to your MP, if they are voting yes, then definitely rather going in from an ideological point of view, go in with the issues of this bill as well, and we can circulate some information afterwards, I'm sure, to highlight some of these issues. And I mean, a lot of them were in the presentation that was shared before as well. Um, if your MP is voting no, then definitely thank them for it. It's great to keep them on side, but also ask them to share information with their colleagues as well, because obviously they will be connected to a lot of other MPs, kind of socially and within different working groups as well. So we do have videos on our website and our Instagram and YouTube, TikTok channels as well. And these very short, bite-sized videos that are quite easy to watch and understand what the issues are. So they're very easy for MPs to pass around as well. So again, that's something else that we can share after this meeting. But I'd say asking them to share more information with their fellow MPs is a good place to go if they're already on side for this.
Thank you very much. I just appreciate we're a bit over time, but there's just one um a question there about conscientious objection. Do you want to just touch on that quickly, Nadia? And then we'll wrap up.
Yep. So very quickly, the question is that can we object? Is there any way we can object to conscientious reasons regarding referral or being involved in assisted dying, similar to abortion referrals? Abortion. So you have no legal or statutory obligation to refer for abortion as a doctor. Obviously, we've got GMC guidance that we need to ensure that we allow people who want to have an abortion to access timely support. And you don't actually have to be part of the referral process yourself for abortion, but you need to be able to signpost to people who can provide adequate support within that process itself. There is no such sort of correlating safeguarding within the assisted suicide bill as it stands. Again, huge unknowns about how the GMC and how the professional bodies will end up giving us code of conducts and guidelines and practice around this. So that's another concern.
Thank you very much, Pete. Thank you so much for joining us. Hopefully we'll speak to you again at another event. Thank you for sharing so honestly and openly. And this has been recorded and we will be sharing. And I'm sure this will be very useful to many people. Thank you so much as well, Nadia, for sharing your insights. And thank you everyone for joining us. And good night. Thank you. Assalamu alaikum.